Today in this video, I'm going to share with you how you can get rid of your sciatica without surgery. Let's go! Hi, I'm Melanie the Physio, also the co-founder of Capital Physiotherapy here in Australia. Are you suffering from sciatica pain? Well, this video is the part 2 of 3 series of sciatica issues. So make sure you hit the like button, the subscribe and the bell notification button right now so you don't miss on our upcoming videos. A lot of people misuse the word sciatica as a diagnosis, but really, sciatica is really a symptom, not a diagnosis. It's a symptom where your sciatic nerve is being compressed, causing radiating pain anywhere down the path of this nerve pathway. It is especially common for people who have sciatic nerve compression to feel pain from their lower back down to their buttock, to the back of their thigh, all the way down to their calf. To properly target your sciatica symptoms and to relieve it, you first need to figure out what exactly is causing the compression on that nerve. If you want to learn about how to relieve your sciatica symptom if the cause of your symptom is by herniated disc, then I highly recommend you check that video out. There are 3 common causes of why people are experiencing sciatica symptoms, and one of the more common reasons is because of what we call spinal stenosis, and this is what we're going to talk about today. Spinal stenosis is basically degeneration of the spine. As your spine degenerates, the height of your spine will start to reduce, and because of that, it causes more compact in the space between each spine's vertebra, and that in turn would start to slowly compress on your nerve that runs in between these spinal bodies. And when the height of your spine starts to decrease so much so to the point that it starts compressing on your nerve, that's when you will start experiencing sciatica symptoms. Some of the more common aggravating factor if you do have sciatica because of spinal stenosis or spinal degeneration is when you stand for a long time, walk for a long time, things where you put pressure on your spine such as jumping, heavy lifting, or arching backwards. So anything arching backward will compress the spine a bit more, then you'll feel more pain. Basically, anything that will cause a compressive force on your spine would lead to increased pressure on your spine and in turn increase pressure on compressing on the nerve, which will increase the pain of your symptoms. Therefore, exercise that you should avoid are things like arching back, which increase the load of your spine, or things like jumping, heavy liftings. Any exercise like that should really be avoided if you're at the acute phase of suffering from these sciatica symptoms. If you want to avoid spinal surgery, then give this exercise a try to see if it helps relieve your sciatica symptoms. Now the first exercise is hugging your knee to your chest. Lie down flat on the floor and hug both knees up towards your chest. Hold this position for as long as you need until the symptom starts to relieve. Normally it takes a good 5 to 10 minutes for the symptoms to start alleviating, and then you can relax back to the starting position. You can also put a pillow or a foam roller right underneath your bum to lift yourself up into more of a curling position, and so as to expand your spine and decompress your spine a little bit more. Repeat these exercises as often as you need to help alleviate your symptoms. The next exercise is pillow decompression. Stack about 2 or 3 pillows on the floor. Lie down on your tummy and make sure you're lying right at your belly button to your hip area. Lie there for as long as you need until your symptoms start to relieve. This position will help decompress your spine and pull your legs and your body up in the opposite direction, expanding your spinal space a little bit, which would help alleviate your symptoms. Repeat this process as often as you need throughout the day to help alleviate your symptoms. The next exercise is a gentle sciatic nerve stretch. Gently pull the painful leg up towards your chest with a towel or yoga straps. Pull as far as you can tolerate. It should be uncomfortable but not to the point where it's painful. Hold that position for about 10 to 15 seconds and see from there whether you can point your toe down and up, down and up. Repeat this process for about 30 to 60 repetitions and then slowly lower them back down again. Try this exercise out once a day. Following on is a gluteal stretch exercise. Lie down flat on the floor, hug your knee up towards the opposite shoulder and you should feel a pull on your hip area. Hold that there for about 30 seconds. Repeat this process for about 2 to 3 repetitions. You can do this exercise as often as you need throughout the day. Now all these exercises is to help with your sciatica symptoms. Now we do have other video that helps with strengthening of your lower back to fix this problem once and for all. So I highly recommend you check this back pain video out after this. Remembering, these exercises that I show you in this video are only beneficial to you if your sciatica symptom is indeed caused by spinal stenosis or spinal degeneration. If it's not, you might find that doing these exercises would not only not relieve your symptom, but it might actually aggravate your symptoms. So if you feel like doing these exercises actually make the pain worse, I want you to stop doing them. You can check out our sciatica video that's caused by herniated disc right up there, or you can stay tuned to our next upcoming video that will explore more exercises that you can do to help alleviate your sciatica symptom if the reason of your symptom is caused by tight hip muscles. I upload video here on a weekly basis on health and fitness related topic as well as injury rehab topic. Once again, I'm Melanie and I will see you in the next video. Until then, stay safe, happy and healthy. Good luck with your exercises. See ya!